Hi there, I'm Dr. Diana.
And I'm Dr. Shalene. Welcome to
Skin
SkinTea.
Tea! Yeah, so join us as we take you through the world of aesthetic medicine. So a couple of weeks ago, I put a Q&A drop box on my stories for you guys to ask us some questions and curiosities that you have about the field of aesthetic medicine.
Yeah,
so today we'll just be answering those questions. Today's focus will be on what aesthetic medicine is and how to take it as a career, or the career path into aesthetic medicine, basically. So yeah, we'll start with the first question.
Yes.
Right, so Doc, maybe you can define for us what is aesthetic medicine.
Yeah, sure. Aesthetic medicine is a branch of medicine that focuses on improving someone's appearance with non-invasive to minimally invasive cosmetic procedures. That's basically that in a nutshell.
Yeah. So when we say non-invasive or minimally invasive, we are comparing it to plastic surgery, because plastic surgery is invasive in that we cut. But in aesthetic medicine, we're improving your appearance and satisfaction, but through little needles here and there.
Yeah, you don't have to go under anesthesia or anything like that for the kind of procedures that we do.
Yes, so our treatments are minimally invasive or non-invasive. So things like botulinum toxin, Botox, your fillers.
Yeah, so you have the injectables, the microneedling, and things like that.
Lasers.
So
it's
that
a whole field.
Yeah.
There's a lot of regenerative treatments. It's a whole field. Yeah.
So the next question we got was, is it a postgraduate degree?
Yeah.
I'll speak on mine first. So my qualification is a postgraduate diploma, and that's the highest level that you can now get in the aesthetic field. What about you, Diana?
Same. The course I'm taking is also the highest level is the postgraduate diploma. And I think for aesthetic medicine, it's not yet developed into a Master of Medicine program. So this is the highest that we can go with our postgraduate diploma in aesthetic medicine. Yeah. Great. So yes, to answer your question, we've still not heard of a master's program in aesthetic medicine.
Yeah.
So the other question was, what are the qualifications to get into aesthetic medicine? So as the name suggests, medicine, so it's a medical field that is only medical professions can specialize in. So you'd need either to be a GP, general practitioner, a licensed GP doctor, or a dentist, a licensed dentist, or nurses. So these are the medical professions that can subspecialize into aesthetic medicine. Yeah.
So the next question is where did we get our training for aesthetic medicine and why we chose those specific places? So I went to Harley Academy. It's in London. I chose Harley Academy because it had a structured program. So it offered theory classes plus practical, and I work very well with structure. And so that's why I chose the program. And the other reason was I didn't actually find any aesthetic training programs in Kenya, as well as the UK has been doing it for quite a long time. So I thought that would be the best place that I'd actually train well. Yeah.
Okay. Same. I also didn't do my training here in Kenya because I couldn't find a training that is comprehensive enough to be able to be a licensed aesthetic
You see the
doctor.
word she used, comprehensive? That's the one I was looking for. A comprehensive structured course is why I chose that one.
But I think they're coming up.
Yeah,
but
they are.
For now, we didn't get that. Yeah, so I took the American Academy of Aesthetic Medicine route. I did mine in South Africa only because in Africa the course is only offered in Egypt and South Africa, so I had to choose between the two. South Africa was more affordable, so I went to the South Africa. But you can do it in the US if you want, in the Middle East. Yeah, it's offered all over the world, and that's why I went with AAAM, the academy, because it's been there for a very long time, more than 50 years, and it's trained doctors, it's trained physicians from all over the world. So that's why I took the course. And that's why I took it in South Africa. Yeah.
Great. So the other question was, how long was the course and what other requirements needed for you to apply? So the course I chose, you had an option to do it within 6 months, a year, or 2 years. I chose to do it within 2 years. Yeah, I chose mine 2 years. And the requirements was just a license, a medical license, and
recommendation letters.
And recommendation letters.
Okay. Yeah. How long hours is? So the triple AM route, if you are on time, you can typically finish it in a year, but it's not compulsory for you to finish it in a year. So that's another thing. You can pace your study as you want. But for me, I'll be doing it in a period of a year from September to September. And the triple AM course is divided into 3 levels. So you can do your level 1, which is a certificate, the level 2, which is a postgraduate diploma, then level 3, which is a board certification exam. So you want to be an American board certified aesthetic doctor.
Okay.
And the good thing, or the bad thing, I don't know, advantage of this course is you can just choose to do level 1. Maybe you just want to be certified as an aesthetic doctor and do those few procedures. If you're comfortable with just having your level 1 certificate, you can practice with that. But you can't do procedures that are licensed for the diploma level.
Oh, I see.
Yeah, so if you want, you can stop at diploma level. If you want, you can stop at the level 1. But it's advisable to just go
finish the
all the
course,
way. Yes, because at the end of the day, you become a full-fledged, all-round aesthetic
So
doctor.
the training the school that I picked didn't structure it that way. So ours is a level 7
injector, which is the diploma level.
Yeah, which is not the diploma level. They don't actually offer anything lower than that.
Yeah, that's great. Then I think if you want to go in fully, you can go to the Harleys.
Yeah.
Then
there's yours as well.
Yeah,
where you can pace yourself.
Yeah, maybe just on a
Does the price change?
Yeah, it gets more expensive.
Yeah. So I think
that's another disadvantage. Yeah, because you guys, you guys pay.
You have to fully
pay as a whole.
Yeah.
For us, no, that's where
you can
the
pace
economic
yourself.
burden comes in. It's all paid differently. You pay your level 1 fee separate from your level 2, from your level 3, and the fees keep increasing. So if maybe you've just done level 1 and you don't have enough funds,
I was gonna say that at least you have that option of like saving up.
Yeah.
You can do your certificate training, and then as you save a bit more, then go for your next one. Which I appreciate that about that
that's
program.
Thing. Yeah, and we have the level 1 trainings are twice a year. Level 2 once a year.
Okay.
Yeah, and then the exam also once a year. So.
Although I will say with Harley, they do offer you can pay in installments.
Okay.
So it's also for you to talk to the school and let them know that you'd like to do that as well. So there is that option.
And I think there was a question on cost. I think for that we can't really. It's allowed, but what we can say is it's quite an investment. That's for sure. It's quite an investment, but it's a worthy one.
Yeah.
Yeah.
Honestly, if you
education is investment.
It is, yeah.
For whatever
I don't think there's a shortcut when it comes to paying this kind of money. Yeah. So it's something you just really need to know if this is where you want to go.
Yeah.
And if you do, then you are willing to put in the money for it. So yeah.
Yep. The last question I think that we got about training was, will we start training aesthetic medicine in Kenya? Yes, of course. We know there's a need. There's a growing need now of aesthetic medicine treatments in Africa as a whole.
Yeah.
And it's good more doctors are also hoping on it. And for us who are already in this industry for now, of course we want more doctors to join us in. So it is a plan for both of us
in the future. Become competent and learn as much as we can.
Yes.
Yeah, because I think that's the beautiful thing about this field as well. There's always something new to learn. There's so many new innovations that are coming in. Every time I'm opening my TikTok, I'm like, there's this too, or there's this, or there's that.
Every day there's so much to learn. Yeah, there's just
it's crazy.
It's crazy.
So definitely. It's something we both want to do.
And maybe as a parting shot, would you advise doctors to join this field from where you're seated?
If it's something you want, it's like me asking someone, do you want to join IMED? It's either you love it or you don't. I think with each and every path that you decide to take, there's challenges in it. So it has to be something you really want to do.
Yeah. But so far, I think.
What's been
so
challenging
great.
for you actually since you've started?
Yeah, that's a good question. For me, I think it's the education part because most people don't have the information. So number one, I think okay, let me just answer it frankly. The most difficult part has been explaining to people what aesthetic medicine is. And it's not in a bad way. It's just it's new, it's developing, it's growing, it's not been here. But yeah, it kind of frustrates you sometimes how you have to keep educating at the same time.
Yeah.
But that's the part. And also not convincing, but because the only way patients will take up a service is if they have knowledge about the procedure. And I think that's why we're also doing this, to just give more insight. Yeah, but that's when you mention aesthetic medicine, some people are just like,
what is that?
Then the reaction of others when they get to know what it is about, especially when you mention we're doing injectables, improving someone's face, but like, no, you're not God, you're trying to change how we look, and it's just a matter of understanding. Yeah, I think that has been the challenge for me. What about you?
Challenging. I think I'll borrow from what you said, which is like having to explain what I do. A lot of people don't understand, and I think it's that whole thing of like, so are you a dermatologist?
Oh yeah.
So are you an esthetician? Like, what are you? And it's kind of like now teaching people how to differentiate between the two, because I will not be able to do what a dermatologist does.
Sure.
A dermatologist actually treats a pathology, like a disease, diagnoses and treats a disease. We don't deal with disease in a sense, right? That's the dermatologist. We now just deal with the appearance of, let's say, your skin or the features that you want to improve in the different ways that we can help you, right? And then the esthetician will help now just maintenance of your skin, right? With non-medical procedures.
Yes.
We do medical procedures. Yeah. A dermatologist will do medical procedures. An esthetician will not. So I think just having to differentiate ourselves in this like skincare industry, I think that's been a bit challenging. Yeah. But it's a challenge I welcome. Yeah, I think, as you said, it's a way to educate people and get them interested in understanding the space.
And the other thing is, I've known is people don't know the benefits they can get from aesthetic medicine treatments. It's not just about, even the Botox itself, botulinum toxin can be used for so many other things that are not for beauty or beauty enhancement. Like Doc would like a Botox for her excess sweating. Yeah, that's part of the treatments of the botulinum toxin. So I think the more we talk about it, the public will also know there's a problem you've been sitting with. Maybe there's a very bad scar that you've not liked on your face or on your arm, and you've tried all sorts of skincare, everything. That scar is not going out. We have treatments that can be able to.
And I think a lot of people really undermine the effects of like how someone's aesthetic actually affects their day-to-day. Like there are people who literally don't want to walk out the door because of like their acne scars and things like that, and they don't live full lives because of that. So there is a need for this field, so that people actually live the lives that they want to live, and it's good for people to know that there are solutions to some of the problems that they're struggling with. So
I'm glad to say there's a need.
There's
a need and there's a space for this because people like to look at it from a vanity point of view only, but we also have to realize we live in a world where also vanity sells, or vanity is, let's say if we go for a job interview, studies have been done to show that if you go to a job interview, this person who looks, good and proper and someone who just comes the way they are, someone who looks a bit, you take care of yourself, put together, these are some of the things that determine a lot of trajectory of our lives in terms of the jobs you get, the people you get to work with. So it's not just vanity.
No, there's such a difference. Because even like if the people that I get to do makeup on, there's such a shift in their attitude. Once they walked into, like once they came and sat on my chair and once they leave, there's just a certain confidence where they're just like, and that confidence is so important because you will walk into rooms and you talk to people that you need to talk to, you know what I mean? And that will now set you into the next trajectory of your career that you never even knew. So don't undermine aesthetics.
Yeah, and remember,
can change your life.
You spend most of the time with yourself. If you're not comfortable with yourself, there's something in your skin, your body you're not comfortable with, you struggle with, it also ruins your quality of life. Because you spend the most of your time with yourself, with your mind, and these are things you're struggling with.
Yeah.
Yeah, at the end of the day, it affects the quality of your life. So there's space for cosmetic medicine.
There
in terms of
is, for
surgery,
sure.
aesthetic medicine, there is space. Even in terms of just beauticians and the beauty industry, there is space for it, and we are glad to be here.
I'm really happy in this space. So happy.
So thanks guys for joining us on this edition of SkinTea. Hope to see you on the next one. Yeah, so keep it here at SkinTea.
Bye.
Bye.